let's have the last topic in this video recitation, which is the meningitis, which is still part of the neuromuscular disorder. And again, prior to have an in-depth understanding or brief discussion or a brief explanation about this topic, is I will be having a blindfold first. Okay, so meningitis, it is simply referring to an acute inflammation of a cerebral, of the cerebral meninges. So there are two types here, or there are two classifications of meningitis. The bacterial, which is obviously caused by bacteria, and it can be fatal if not caught early and treated rigorously with antibiotics. It can still leave um, residual damage. So, and the viral meningitis, which is a self-limiting syndrome, which is usually associated with other diseases such as the measles, mumps, and herpes. So, the therapeutic management is primarily symptomatics. Now, the signs and symptoms here are the child may experience fever, vomiting, lethargy, bulging of the fontanelles. There is also a sign of seizures, headache, uh, irritability, and our pathognomonic sign here is the nuchal or nuchal rigidity. And we also have the two signs here, the Kernig's sign. So when we say Kernig's signs, when the patient lies upon the back and the thigh is flexed to a right angle or a 90 degrees with the axis of the trunk, complete extensions, and the leg on the thigh is impossible. So they cannot flex their thigh. So the next one is the Brodzinski's sign, which is if the child or if the neck is possibly flexed, flexion of the legs occurs. So children usually have um 2 or 3 days of URTI or the upper respiratory tract infection prior to the development of the meningitis. So then they then grow increasingly irritable because of an intense headache. So they experience sharp pain when they bend their head forward. So in the newborn, symptoms such as poor sucking, weak cry, or lethargy development as the disease progresses. Signs of meningeal irritability then occur as evidenced by positive Brudzinski and Kernig's signs. So for the assessment here, so children may hold their back arc and their neck hyperextended or opistotonus. So if third and sixth cranial nerve paralysis occurs, so the third um oculomotor or third cranial nerve is the oculomotor and the sixth is the abducens. So a child will not be able to follow light through full visual fields. If the fontanelles are open, they bulge upward and feel tense. And if they are closed, papilledema may develop. So if the meningitis is caused by H influenzae, the child may develop septic arthritis. So if it caused by a Neisseria meningitis, a papillary or purple petechial skin rash may occur. So after this beginning of a myriad of general symptoms, sudden cardiovascular shock, seizures, and nuchal rigidity or apnea can occur. So because the infant has open fontanelles, nuchal rigidity appears late and is not as useful a sign for diagnosis as in the other child. So as a rule, a child with a high temperature who then has a seizure is assumed to have meningitis until CSF findings prove otherwise. So CSF analysis obtained um, by lumbar puncture confirms the diagnosis. So the diagnosis test is the CSF analysis, which results to cloudy increased intracranial pressure, and then there is also a high white blood cells and proteins is high and the glucose decrease and the culture and gram stain are positive. So the therapeutic management here is having an antibiotic therapy as indicated by sensitivity studies is the primary therapy. So intrathecal injection directly into the CSF may also be necessary, especially because the blood-brain barrier may prevent the chosen antibiotic from passing freely into the CSF. So in some children, um, it takes a month before the CSF cell count returns to normal. So, corticosteroids such as dexamethasone or the osmotic diuretic mannitol may be administered to reduce ICP and help prevent hearing loss. So, in addition to standard precaution, children with meningitis are placed on respiratory precautions for 24 hours after the start of the antibiotic therapy to prevent transmission of the infection to other family members or healthcare providers in addition sorry uh, healthcare providers. So, in addition, an antibiotic may be prescribed prophylactically for the child's immediate family members or for playmates who have been in close contact with the child to minimize the spread of this disorder. And also, they need to have an adequate hydration. And if there is an appearance of fever or pain, administer antipyretics. That's it po for the meningitis. Thank you po.